Yes, dear students, in connection with our earlier class, that is discussion on the anti-malarial drug, today we are going to discuss the individual drug which are involved in the treatment of malaria. Now, already we have discussed the classification based upon the at what stage that anti-malarial drugs are going to be at, that is based upon the clinical use of the anti-malarial drug. Earlier to that we have also discussed the life cycle of the malarial parasite. Now today we are going to discuss the individual drug which are involved in the treatment of malaria. Now those are cinchona alkaloid, quinine methanol, 4-aminoquinolines, 8-aminoquinolines, then 9-aminoquinoline, naphthaquinone, biguanides and diaminopyridines. So this classification we have already discussed in the last class. Today we are going to discuss the individual drugs which are involved in the treatment of malaria. Now our first drug is chloroquine and its derivative, that is containing 7-chloro-4-aminoquinoline. Now what are these actually quinoline compounds and why they are introduced or why we are going to use those compounds in the treatment of malaria? Now those are the quinoline compounds. They are actually obtained previously from the natural sources, that is cinchona bark. Now cinchona bark contain a mixture of more than 20 alkaloids. Now the cinchona alkaloids, these are basically from the family that is cinchona alkaloids, and they contain more than 20 alkaloids in this bark, out of which 4 major alkaloids are isolated from it, which are effective against the erythrocytic merozoites and constitutes a part of suppressive treatment for the malaria. Now, no doubt we are going to obtain the 20 alkaloids, but out of these 20 alkaloids, these 4 alkaloids are going to have the erythrocytic or they are going to inhibit the merozoite stage, which is one of the important stage in the malaria life cycle. All these are the derivatives of 4-quinoline methanol, which is linked with the substituted quinine nucleus. Now in this case, if we are going to that is quinine is a methoxy derivative, then quinidine is an methoxy dextroisomer, which is going to also have the anti-arrhythmic property along with the anti-malarial action, cinchonine and cinchonidine. So these are the drugs which are isolated. We are going to isolate from the cinchona bark. Now before we are going to discuss the structure activity of individual drug later on. Earlier to this we are going to discuss what are these quinoline derivatives that are obtained from the cinchona alkaloids, that is quinoline sulphate, chloroquine, amodiaquine, primaquine phosphate, primaquine and quinacrine hydrochloride, mefloquine. So these are the quinoline derivatives used in the treatment of malaria. Now the first drug of our discussion is quinine sulphate. Now this quinine and its dextroisomer, that is quinidine, quinine and its dextroisomer, that is quinidine, are the cinchona alkaloids currently we are used in the treatment of malaria. Quinine is the most active anti-malarial ingredient of the cinchona bark, and it is present in highest concentration at an extent approximately 5%. It is schizonticidal and gametocidal for Plasmodium vivax and Plasmodium malariae. It is orally active in the form of sulphate, while quinine hydrochloride may be used for IV administration. The antimalarial activity is associated with the levorotatory form of the quinine. Subcutaneous and intramuscular administration is not usually recommended for the local use of these type of drugs. Now, what is the structure-activity relationship of these quinine and its derivative structures? Now, this is the structure of the quinine, that is cinchona alkaloid derivatives containing quinine ring, in which the asymmetry which is present at third and fourth carbon atom, which is not essential for the antimalarial activity. Now, at carbon 8, that is addition of halogen, that is chlorine, fluorine and bromine, will enhances the activity. If we are going to substitute something at 8th position, that is something belongs to the substitution of the halogen atom, which will enhance the activity. Then carbon 9, that is secondary alcohol, that is presence of the secondary alcohol at carbon 9 or modification of the secondary alcohol by oxidation. Now we all know the hydroxyl functional group undergo oxidation will give the carbonyl compound, or we can esterified this hydroxyl functional group, but the oxidation and esterification of this hydroxyl functional group will diminishes the activity. Then the carbon 4, that is quinine portion is not essential for the activity. That is carbon number 4, the quinine position is not essential for the activity, so it can be replaced with the 4-amino-quinolines in the case of chloroquine, amodiaquine and piperaquine. So the fourth position substitutions are changed in the case of lateral drugs, that is chloroquine, amodiaquine and piperaquine. Then carbon 6, substitution at 6th, that is substitution of methoxy or hydrogen, they are replaced with the chlorine or trifluorocarbon atom, increases the activity. If we are going to substitute this R at 6th carbon atom with the halogen, that is chlorine or trifluoromethane, will increase the activity. Introduction of phenol but not alkyl group at carbon number 2. If we are going to introduce the phenyl substitution but not the alkyl substitution at this carbon atom, in the case of quinoline ring, increases the activity of antimalarial by blocking the metabolic oxidation of quinoline to the dihydroxyquinoline. That means substitution at 2nd position will hinders the metabolism, but substitution at this 2nd position also increases phototoxic effect by addition of trifluoromethane at 2nd position, and the substitution of trifluoromethane, the name of the drug is mefloquine. So this is the structure where we have substituted the trifluoromethane carbon atom at 2nd position, will increases the phototoxicity. So this is all about the quinine and its structure. The structure activity studies of quinine nucleus having very much importance, that change in the alcoholic functional group, change the substitution at 6th position, substitution at 2nd position and so on. Now the next derivative which is coming in picture with respect to the quinoline nucleus is 8-amino-quinolines. Now these 8-amino-quinolines are the drugs in this group have presence of amine functional group at 8th position. So the examples of the drug which are coming under the category of 8-amino-quinolines are, 4 examples are there: primaquine, palmaquine, pentoquine and quinoclide. So these are four the drugs which are coming under the category of 8-aminoquinolines. The very much basic property is with respect to the 8-aminoquinoline nucleus is presence of amino functional group at 8th position, and very much importance that we have already discussed in the previous class, that is cinchona alkaloid, that is presence of methoxy functional group at 6th position. So this change in the structural property will gives the new class of the derivative, that is 8-aminoquinolines. Examples of these type of drugs are primaquine, palmaquine, pentaquine and quinoclide. Now what are the structure activity relationship substitutions at 8-aminoquinoline nucleus? At 6th position, already we have discussed that 6th position there is substitution of methoxy functional group will increases and gives the high therapeutic index with respect to the antimalarial class. It may be substituted with the hydrogen and hydroxyl functional group. That again, if we are going to introduce the at 2nd position methoxy functional group, and will also increase the therapeutic index with respect to the antimalarial derivatives. Then introduction of 2nd methoxy group gives the high therapeutic index. Optimum activity was obtained if we are going to substitute CH2 bridge between the NH carbon atom, that is amine carbon atom. If we are going to introduce the CH2 bridge at this carbon atom, the even number of CH2 group is lesser toxic than the odd number of substitution of the CH2 group at 2nd position. Then extent of substitution at terminal carbon atom is not critical as 4-aminoquinolines. Now we have restricted the substitutions at 4-aminoquinolines, but this is not the case with the 8-aminoquinoline derivatives. The terminal aliphatic amino groups may be substituted with the primary, secondary and tertiary. Now the new category of drug is arise, that is primaquine, in which the terminal carbon atom is substituted with the this type of bridge. So this is all about the 8-aminoquinolines, in which primaquine, palmaquine, tefloquine are the antimalarial drugs from this class. Belongs to the family that are 8-aminoquinolines. Palmaquine is closely related to the primaquine. Palmaquine is going to have a close resemblance and similar type of actions with respect to the primaquine. Compared to the primaquine and palmaquine, palmaquine is more toxic and less efficacious. So this drug is more toxic than the primaquine and less efficacious. In contrast to the 4-aminoquinolines, these agents lack activity against erythrocytic merozoites. That means 8-aminoquinolines are going to have the less action against erythrocytic merozoites. In fact, they attack both the pre-erythrocytic phase of the disease and also show gametocidal activity to the some extent. That means no doubt that they are going to have the less activity against the erythrocytic parasite, but they have the activity against the gametocidal activity as well as erythrocytic phase to the some extent. Obviously, if used alone, they can be only used for the prophylactic purpose of the antimalarial drug. They produces radical cure against the Plasmodium vivax malariae when they are used along with the chloroquine. That means this drug can be coupled with the chloroquine and used against the Plasmodium vivax type of infection. The antimalarial activity of primaquine is due to its ability to interfere with the protein synthesis. This primaquine, along with showing the erythrocytic merocytes inhibition as well as gametocidal action, along with this primaquine is having ability to interfere with the protein synthesis, with the enzymes and with the erythrocytic phospholipid. It is usually given along with in connection with the 4-aminoquinolines. That means primaquine is usually coupled with the drug, that is 4-aminoquinolines, to show squeezonticidal action. They are also used against primary exoerythrocytic forms of Plasmodium falciparum infection. So this is all about the class that is 8-aminoquinolines. Now the next classes of the drugs, those are the category that is this 4-aminoquinolines, so the mode of action of our earlier drugs, that is quinine sulphate. Quinine intercalate the parasite, that is inhibits the ability of hemoglobin digestion of the parasite. Thus parasite starves the building of toxic level of the partially degraded hemoglobin in itself. So the possible mode of actions for the quinoline derivatives are they are going to degrade the hemoglobin in their cell. That heme is released as a ferriprotoporphyrins and produces hemolysis of the erythrocytic parasite. So these drugs coupled with the heme cell and produces ferriprotoporphyrins 4 and gives the hemolysis of erythrocytic parasite. So this ferriprotoporphyrins is released and it is converted to the non-toxic products, and they in turn do the hemozoids by the polymerase reaction. So this is the mechanism of action, that they are going to convert the heme cell into ferriprotoporphyrins 4 and do the hemolysis. Quinine is an erythrocytic schizontoside of all the types of Plasmodia, but they are less effective and more toxic than the chloroquines. Doxycycline and clindamycin is usually added in and coupled with to complete the parasite clearance. That means quinine sulphate is every time coupled with the drug, that is doxycycline and clindamycin, to give the complete parasite clearance. Quinine has no effect on the pre-erythrocytic phase and hypnozoid phase of malaria, but kills the vivax gamete, Plasmodium vivax gametes. The other actions of the quinine sulphate gives the local irritation and anesthetic effect, systematically enhances GI secretion, and quinine is a weak analgesic and antipyretic. Some of the pharmacokinetic parameters of the quinine sulphate, they are readily absorbed orally. Their protein bound concentration is almost 70%. Alpha acid glycoproteins also bind with the quinine sulphate. They are going to have the low cerebrospinal fluid concentration. Large fraction is metabolized in the liver with the cytochrome P cysteine and excreted in the urine. The particular T-off of the quinine drug is 10 to 12 hours. They are metabolized in the liver. Conversion of quinine to 2-hydroxyquinine. Therapeutic uses are treatment with the severe Plasmodium falciparum malaria. Quinine may also used in the supraventricular and ventricular and other forms of the malarias. Next drug is chloroquine. The mechanism of action of chloroquine, that this is the structure of chloroquine. containing 7-chloro, 4-diethylamino, 1-methyl butyl amino quinoline. It interferes with the hemoglobin digestion and ability of the Plasmodium species, actively concentrated in the infected RBCs of the parasite, accumulated in the acidic vacuoles of the parasite because of its weakly basic in nature. Polymerization of the toxic heme generated from the digestion of the hemoglobin to non-toxic parasite pigment, that is hemozoid, is inhibited by the formation of chloroquine heme complex. Chloroquine also damage the plasmodial membranes, and additionally they are interfering in the protein as well as nucleic acid synthesis. The pharmacology behind chloroquine is they are rapidly acting against the erythrocytic schizontecide, that is earlier phase of the schizontecide, against all types of Plasmodium species. All 4 species can be inhibited by chloroquine. Therapeutic plasma concentration is achieved 50 to 30 nanogram. They have no effect on the primary, secondary hepatic stages of the parasite and does not prevent the relapse in vivax and ovale type of malaria. Chloroquine resistance is developed in India. Resistance in the Plasmodium falciparum is associated with decreased ability of the parasite to accumulate in the chloroquine. Chloroquine resistance amongst the Plasmodium vivax was first reported by Papua in 1989. Pharmacokinetics parameters: orally well absorbed, 50% protein bound, and having high affinity for melanin and nuclear chromatin. Get tightly bound to the tissue constituents, and they are much more concentrated in the liver, spleen and kidney. Its selective accumulation in the retina, that is eye retina, is responsible for the ocular toxicity which is seen in the prolonged use. If the treatment is given for prolonged therapy, in that case the accumulation of the drug happen in the retina, which will give the ocular toxicity. Chloroquine is partly metabolized by liver and slowly excreted in the urine. Some of the adverse drug reactions like nausea, vomiting, anorexia, uncomfortable itching and so on. They are contraindicated in the patients with lemur damage, neurological and retinal damage patients, and those having hematological diseases. Chloroquine can be used for the treatment of malaria during pregnancy. No abortifacient effect is associated with the chloroquine. Chloroquine should not be contraindicated, co-administered with the mefloquine, amiodarone and other antiarrhythmic drugs. So it is used in the treatment of malaria of all species, causes rapid fever clearance and extraintestinal amoebiasis, rheumatoid arthritis, discoid lupus erythematosus, then lepra reaction, pathogenic reactions and infectious diseases. In these such all cases we can use chloroquine. Now there is a synthesis of chloroquine which is there in the syllabus, in which the 4,7-dichloroquinoline is coupled with or reacts with the 1-dimethylamino 4-amino pentane adduct. So there is a conjugation reaction between the 4,7-dichloroquinone nucleus with the dimethylamino 4-diethylamino 4-amino pentane, and there is a formation of the hydrolytic bonds are cleaved with the help of hydrochloric acid, and the drug product is generated, that is chloroquine. Next drug is amodiaquine. The chemical name and structure of amodiaquine is 4,7-chloroquinidine 4YL, 4,7-chloroquinidine 4YL, 2-diethylamino methylphenol. So this ring is totally nominated differently along with the quinoline nucleus. This drug has similar action with respect to the chloroquine. Amodiaquine has tend to be administered in the areas of chloroquine resistance. When the chloroquine resistance is developed, so instead of chloroquine, we can give the drug amodiaquine. While some patients prefer its tendency to cause less itching than the chloroquine. Chloroquine having a side effect that is itching. Amodiaquine is now available in the combined formulation with the artesunate. It is among the artemisinin combination therapies recommended by World Health Organization. This is also used for chloroquine resistance falciparum malaria. So this can be used against the disease falciparum malaria. So this is all about today, and the remaining drugs we will discuss in the next lecture. Thank you.